Next presentation is about physician-industry relations in the era of AdvaMed, and this is by Russell Samson.
So first, obviously, my disclosures, and I'd like to say I'm not receiving any bribes or any undercover inducements from industry, despite the fact that I request them on a regular basis. I did use a $2.5 ballpoint pen when I was trying to work out this presentation, and I did have a slice of pizza from a drug company 3 weeks ago, so that's my relationship with industry. The topic is really relations, and the definition of relations is contacts or dealings between two or more people or groups. And when we're talking about physician and industry, we do really have a common ground, and that's information. And when information passes from a physician to industry, we get new and improved technologies and medications. And when there's information passed from industry to physicians, hopefully it results in improved patient outcomes and cost-effective treatment paradigms. Of course, the other general area where we have something in common is education. And with education, as this slide shows, comes money. And when money enters the picture, it is true that there have been abuses over the past between physicians and industry that have resulted in junkets to fancy resorts, exorbitant dinners, and outrageous fees that have been paid to some of our fat cat researchers and spokespeople. So because of this, the industry, pharmaceutical and device manufacturing companies have promulgated codes of ethics that limit the interaction between physicians and industry. And the reason for this is really to abolish any of these abuses that occur because of this relationship, to prevent prescribing and purchasing and using medications or equipment based solely on incentives provided by industry to the physicians, and therefore to stop costly and inappropriate and inefficient health care. Now, the government has gone even further, and I think everybody is aware that at 2012 we'll be getting the Sunshine Act, and there are also proposals like this that are already in existence in New Jersey, Vermont, and Massachusetts that actually limit the interaction even further than that promulgated by the codes of ethics. So you may ask, how is this going to affect you? And I think this slide shows it perfectly. I think we're all going to get screwed. So I think a code of ethics is appropriate to restore our trust with our patients, but I think we shouldn't throw the baby out with the bathwater. So what are these codes trying to do? Well, they try to reduce the personal interaction between the sales force and the physician, and then remove any financial incentives to physicians or their organizations. But we see these people everywhere. We see